So I'd like us to get started. Yes, absolutely. I'm gonna go ahead and just get us started while you find your seats. If there's anything you need to know where the bathrooms are, anything like that, you can just ask at the registration table. And so I think we're just gonna jump right in. So thank you for coming to the first meeting of the Institute of Medicine Committee on Community-Based Solutions to Promote Health Equity. And to kick us off, Dr. Dzau, who's president of the National Academy of Medicine, is going to provide some opening remarks. So, Dr. Dzau.
Well, good afternoon. That's great to see all of you here, many friends and familiar faces. So let me welcome you to this first meeting of the Committee on Community-Based Solutions to Promote Health Equity in the United States. First, let me just thank all of you for taking time off your very busy schedule. I know how busy you are, but I think we all care about this very important area. So that's why you're here, and we really appreciate it. I want to particularly thank the Robert Wood Johnson Foundation, and of course, Jim Marks, who's here next to me, and Kim Elliott, and Dwayne Proctor. Who's Dwayne? There he is, and Kim. And, really, I think, and of course, my good friend, Risa Levisamori, they, in many ways, really get us going, thinking about this, an area that we all care about, area that you care about, but in some way help us kind of provide the framework to go forward with a multi-year plan on this culture of health and health equity. So this is, in fact, the first activity launch under the launch of Culture of Health at the NAM/IOM. I think practically everybody asks the first question, what is the culture of health, right? And of course, we all have our description and explanation, but I think that most of us knows it's really intrinsic in what we do every day, a culture that enables us to move forward. I do have a slide that has Risa's quote, which is, a culture of health is where good health flourishes across geographic, demographic, and social sectors, where being healthy and staying healthy is an esteemed social value, and where everyone have access to affordable, quality health care. Now, that's where you come in, because equity very clearly is stated in the last few sentences. And I was earlier talking to Jim about, equity and culture of health. And I know, and I agree with him, that really to achieve culture of health, you really have to address equity issues. And that's really why we're starting the program this way. Well, you know this, but, my specialists prepare a very nice slide to say equity is when everybody's opportunity to attain their full health potential, and no one's at disadvantage of achieving this. And of course, health inequity is the flip side of all those things, and remains to be really one of the biggest challenges, if not the most important challenge, I think, in the whole arena. When I think about where we are today, and, we just had this big meeting on human genome editing, and people talk about sequencing. Technology is just amazing, and yet when you look at the health status of our population and health equity, we have such a long way to go. So there's a real disconnect in the sense of equity between where we should be and where we are today. Now, I just want to spend a few moments kind of personally making some remarks, because health equity is very important to me. Many of you know me as a physician scientist and say, well, how does he get involved with this? But I would remind you that first, I was born post-war China and observe a lot of poverty and health inequity. And also, in my last 10 years at Duke as the CEO of a health system in Durham, where we have a community, truly a city, two cities within one, we see tremendous disparity. And so what became very clear to me through my own life's journey in global health to this is that the only way that we're going to truly be able to address the health issue is to get involved with social and other issues. So I'm proud to say that personally, I got very involved with many of those things, including I was telling Dwayne, earlier, a task force I started, which we now form an NGO that tries to deal with youth, marginalized youth who's dropped out of school, how to get them jobs, how to get them back into school. And I say all this simply because the point I want to make is that we really have to have a systems approach to this whole thing. You can't simply look at equity as one single dimension. It's a multi-dimension. It's everything that we do in every day in our society and addressing all those issues that's so important. So in that context, you know this well, and I'm not going to spend any more time talking about this because you're so familiar with it. Suffice to say that the charge that in U.S., I think we have just tremendous disparities. And of course, at the end, what we really have to do to achieve equity, as I said, is to look at all the social aspects from a system level, look at access, of course, importance and quality as well. So I want to make sure that I have a chance, and maybe you already have, and perhaps the chair will also make sure that you know your statement of task. But I do want to emphasize the following. First, to review the health disparity status, state and U.S., and to look at condition root causes. Second is very important is to identify and use 6 examples of community-based solutions. And of course, also identify the major elements of effective solutions and recommend short or long-term strategy, and then eventually key research needs. And here I would say that as I think about my own experience, and again, I say you know so much more than I do, I think I would say 3 things. Systems approach, not looking at fragments of it, but looking at the totality. When I think about those people who are in need of medical services, they need social services, why do they have to shop in all over the place? But in fact, we know about education, about jobs, so many things are really part of the entire approach. Second is community-based approach. I think that it's so important that people learn and pilot at a community level, so we learn from those and begin to see the commonalities and then see how we can actually scale and replicate. And third, actually, I don't want to steal Jim's thunder, but in fact, he's going to talk about it as public policy. I do believe that's really important, and I will leave that him to talk about that. Now, I just want to tell you a little bit of example of experience I had at Durham. You know, as a system, we talk about how we can address this issue of equity. And as a research organization, we say, okay, that research piece is an opportunity. We brought together people from different schools who are using geographic information system. We collaborated with the Durham Public Health, with the law enforcement, with other public data and whatever, and we begin to map, using geographic information system, things like this. Diabetes. Where are the patients' diabetes? Where's the closest grocery store? Where's the pharmacy store? Where's the closest clinic? When we begin to actually design care delivery and health promotion by understanding where the issues are. And to me, that's kind of systems approach, using all the information together and trying to address this issue. And I'm not trying to tell you what you should be thinking about, but I just wanted to tell you this is one such example. Now, at IOM, we have long history in health equity, and Rose and her team should be very proud because on their board of population and public health, and we're so glad she's taking lead on this, of course, is roundtables on health improvement, health equity, and series of publications. And as Jim and I and this team were talking about, imagine on this particular initiative, we have 5 years, starting with this. Well, we could spawn, as he suggested to me, the quality, like we have the quality series. We have like 12 reports, 15 years of about how to improve quality. This is our equity series that, in fact, lots of kind of spawning more reports and ideas of how to continue to address this issue. And here's some examples of many reports that Rose and others have done. Finally, I just want to say one last word. of how important this is to IOM and NAM. In one of the initiatives that I'm working with Mark McClellan, it's called Vital Direction Health and Healthcare. We are working on a series of activities that's preparing to inform the next U.S. administration about what is missing in our current plan. We're not weighing in politically. We're just simply saying based on our experience, and we have a lot of very knowledgeable people on our steering committee, and we're trying to reach out to many of you to say, what is the information? How do we move this forward together? We have Bill Frist and Mike Levitt on the committee, which says, target this information to the transition team. We've come up with 3 areas. There you go. The first one, better health and well-being. Let me read to you the topics underneath that. Systems integration for better health throughout life course, addressing health disparities and social determinants of health, preparing for better health and healthcare for the aging population, integrating mental health, substance abuse service throughout care, healthy community population health, and public engagement. What we hope to do is to engage people to join us in writing perspectives and ideas, and then coming together with a summit to take these 3 topics, data, science, technology, value-based care, and health inequities, together to form a synthetic document that we can actually provide the next U.S. administration transition team as they think about what they're going to do in healthcare. And I want you to be really a central part of this, and we'll keep you involved and informed about this. So that's what I wanted to say. I just want to tell you how important this initiative is. It is in our DNA, and I really thank the Robert Wood Johnson Foundation to help us get there. And of course, I was so excited when I learned about a few years ago your whole push towards culture of health. I think that's how we're going to hopefully find solutions. Thank you very much. Amy?